If you're listening to this podcast on YouTube, for a better experience, switch to the video version. The link is in the top right corner of the video and in the episode description. Hello and welcome, I'm Fernando, a GP in the UK. Today we're looking at the new updated NICE guideline on type 2 diabetes in adults, always focusing on what's relevant in primary care only. The link to the NICE guideline is in the episode description. The diabetes guideline is a comprehensive document, so I'm going to break it down into manageable sections. Today we will focus on the first part of the NICE guideline, covering tailoring care, structured education, dietary advice and bariatric surgery. In future episodes, we will move on to drug treatment and the management of complications. Right, let's jump into it. First, let's start with tailoring care to the person. NICE recommends an individualized approach for adults with type 2 diabetes. Care should be tailored to the person's needs and circumstances. This includes their personal preferences, the other medical conditions, the risks from polypharmacy, and the likelihood of benefiting from long-term treatments. This is especially important for people with multimorbidity. At each review, we should reassess the person's situation and think about whether any medicines are no longer effective and could be stopped. When planning care, we should take into account any disabilities, including visual impairment. For discussions about overweight and obesity, NICE directs us to the guideline on overweight and obesity management, including how to classify overweight and obesity and how to address the drivers behind it. There is also a specific section in the guideline on eating disorders for those who have both type 2 diabetes and an eating disorder, covering advice on collaborative care, blood glucose management and insulin use. Next is structured education. NICE says we should offer structured education to all patients with type 2 diabetes at diagnosis. Family members or carers should also be involved where appropriate. Education should be reinforced and reviewed every year, and it should be explained clearly that structured education is a core part of diabetes care. Education programs should be evidence-based and suitable for the person. They should have clear aims and learning objectives, and support people to develop the knowledge and skills to self-manage their diabetes. Programs should follow a structured curriculum, be delivered by trained educators, and outcomes should be regularly monitored. Group education is the preferred option, but there must be an alternative of equal standard for people who cannot attend or prefer not to take part in group sessions. Education programs should meet local, cultural, language, cognitive and literacy needs. All members of the diabetes team should know what programs are available locally, and these programs should be integrated into the overall care pathway. Now let's move on to dietary advice. Adults with type 2 diabetes should receive individualized and ongoing nutritional advice from a healthcare professional with expertise in nutrition. Dietary advice should be sensitive to the person's culture, beliefs, willingness to change, and the impact on quality of life. In general, people with type 2 diabetes should follow the same healthy eating advice as the general population. This includes choosing high fiber, low glycemic index carbohydrates, such as fruit, vegetables, whole grains and pulses, choosing low-fat dairy products, eating oily fish, and limiting saturated and trans fats. For low energy or very low energy diets aimed at remission, the guideline directs us to the specific guidance on the NHS Type 2 Diabetes Path to Remission program and the Overweight and Obesity Management Guideline. Dietary advice should be integrated into a personalized diabetes management plan, including physical activity and weight management. Carbohydrate intake, alcohol intake, and meal patterns should be individualized. Reducing the risk of hypoglycemia is particularly important for people using insulin or insulin secretagogues. People can substitute a limited amount of sucrose-containing foods for other carbohydrates in their meal plan, but they should avoid excess calorie intake. NICE advises against using foods marketed specifically for people with diabetes. For people admitted to hospital or another care setting, There should be a meal planning system that provides consistency in carbohydrate content. Finally, let's talk about bariatric surgery. For people with recent onset type 2 diabetes, we should follow the recommendations on surgical interventions in the Overweight and Obesity Management Guideline. This guideline is separate to the diabetes guideline, but we will cover it briefly here. It says that we should offer adults a referral for a comprehensive assessment by a specialist multidisciplinary overweight and obesity management service to see whether bariatric surgery is suitable if they have a BMI of 40 or more, or a BMI between 35 and 39.9 with a significant health condition that could improve with weight loss. These conditions include cardiovascular disease, hypertension, fatty liver disease, obstructive sleep apnea, and of course type 2 diabetes. The person must also agree to long-term follow-up after surgery, including lifelong annual reviews. For people of South Asian, Chinese, other Asian, Middle Eastern, Black African, or African Caribbean background, we should use a BMI threshold that is 2.5 lower than these values, because cardiometabolic risk occurs at lower BMI in these groups. We should refer for expedited assessment for bariatric surgery people with a BMI of 30 or more who have recent onset type 2 diabetes, defined as diagnosed within the past 10 years, provided they're also being assessed within a specialist overweight and obesity management service. Again, for people from South Asian, Chinese, other Asian, Middle Eastern, Black African, or African Caribbean backgrounds, we should use BMI thresholds that are 2.5 lower when deciding on expedited assessment. So that is it, a review of the first section of the NICE guideline on type 2 diabetes. We have come to the end of this episode. Remember that this is not medical advice, but only my summary and my interpretation of the guidelines. You must always use your clinical judgment. Thank you for listening, and goodbye.